Hi, Dr. B here of AskTheDentist.com. So today we're going to talk about what very few people like to talk about, and that is wisdom teeth and why we should take them out, at least most of us. So first, what are wisdom teeth? Those are the teeth that come in when you're between 14 and 17, 18, 19, sometimes even 25 years old. They're the last set of molars that come in and complete your dentition. So why take them out? Well, unfortunately, a lot of our jaws are too small to accommodate those teeth that come in later in our teen years, and there's no room for them. So they come in sideways, they don't come in at all. They impact the teeth that are there, hence the terminology impacted wisdom teeth, and they can cause a lot of pain. And they typically cause pain, I don't know why, but they do, right before a wedding, before exams, before an important event. If you leave them in, there are consequences. A lot of pain. It's always at the least convenient time, before a trip, before graduation or a wedding, and your face can swell up. And also, there is a high likelihood, a 25% chance that later you'll get cancer around the little follicle, the skin, the sac around the wisdom tooth. So even if they don't come in, you may think, oh, that's fine. It's not. There's this little window when the teeth are very easy, the wisdom teeth are very easy to take out for the surgeon, and that actually makes it easier for you when you have those teeth taken out. So when is this ideal window? It's going to be something that you have to discuss with your dentist. Your dentist is going to have to make that call. This window occurs when the second molars have come in. That's usually around 12. Those are called the 12-year molars. It can be a little bit later, it can be a little bit earlier, but the jaw, the bottom jaw, has fully developed, so you know the size of the jaw, and if there's room for third molars, wisdom teeth, to come in, then you let it go. But if there isn't room for those teeth to come in, then you know that would be a good time, perhaps, or in a year or two, to take them out, because those teeth are still small. They're like little marbles, and instead of being pulled out, they can be rolled out. So that's that window. So don't wait until 18 to 21, which is when most of us get our wisdom teeth out. So again, ask your dentist, say, is there an ideal time, earlier perhaps than when most people get their wisdom teeth out, to roll these out, because there'll be less trauma to the bone, which means less pain for you. So you're watching this video and you just realize you're past this ideal window. You may be 18 or you may be 36 like I was when I had my wisdom teeth taken out. And that just means that it's going to take a little bit more work and a little bit more attention, and it may take a little bit longer to recover. So don't panic, but if you have that opportunity to take advantage of that window, do so. It'll help you a lot. So the first tip is one that I've been giving for a while, but often is not in the instructions that are given by the oral surgeon. That is, stay upright. The minute you lie down and you have a wound in the mouth, and if that wound is at the level of the heart or lower than the heart, because of dilation and how blood flow dynamics occur, a lot of blood's going to go to the wound, more blood than if you were upright, and hence you're going to have a lot more pain, even more swelling. The second tip is the surgeon will ask you to keep some gauze in there, probably for the first maybe 4 or 5 or 6 hours, and he's going to ask you to change that gauze, and that gauze puts pressure on the wound. But if that gauze is dry and you put it in your mouth and then an hour later take it out, the dryness of that gauze may bond with the blood clot, and when you take it out, you pull out the blood clot inadvertently. That causes a dry socket, and we all know what that means: a lot of bone pain. The third tip, and this is one of my favorites, and I've been doing this now for about a year, and with spectacular results, and that is CBD oil. Take a little CBD oil before your oral surgery, your appointment for the wisdom teeth, because that reduces anxiety, makes you more relaxed. That can only help. And then keep taking the CBD oil right up until you get past that 72-hour mark, which is when the pain usually peaks. And that will, it's a great a pain pill in a way, without all the side effects of, the narcotics and the constipation and wooziness and nausea and all that. And it just prolongs the recovery time. So try CBD oil, but talk to your dentist about it first and discuss what the dose is, and try it. I think these 3 tips are going to really make it a much more tolerable procedure for you. So I highly recommend you try those 3 tips. Also, go back to AskTheDentist.com, read our article on what to do after wisdom teeth surgery, include those 3 tips, and I think the whole procedure will be much more pleasant. Hope that helps. Thanks for watching.